Hi, labor and delivery friends. I just need a few minutes of your time to tell you about some epic changes and offer some clarification. We've seen some double documentation of blood loss. So, along with anesthesia, the decision was made to standardize the process and mitigate blood loss documentation errors. So, this is going to be in surgical cases, which for us is mostly C-sections. And when a nurse documents a QBL in a C-section, it will override anesthesia's EBL and will not be counted in the total blood loss. First, there's going to be 3 Qbl calculators, and we need to make sure we choose the correct one. So when you're in the delivery summary, now there's going to be a vaginal delivery QBL and an OB surgical QBL. Postpartum QBL still lives on the flow sheet and will continue there. But if you're going to have a C-section, be sure to pick OB surgical QBL. And we're going to talk about that first. It's going to open up and look like this. Make sure you have C-section QBL calculator at the top, and that way you'll know you're in the right calculator. You'll put in your dry weights. Once you hit accept on this, then anesthesia's documented EBL will not be calculated into the blood loss total, and we need it to be calculated in our total. So if you feel that anesthesia's number that they give you, the blood loss number they give you, is quantified, say they just looked at the suction canister and have subtracted the saline, that's quantified, so we would add it into our total here. But sometimes anesthesia does have to estimate blood loss, and if that is the case, then we need to make sure it's counted and put it in as an EBL, which is in the delivery summary under lacerations. There's an EBL line. We want that blood loss to be counted, and it's up to nursing to make sure that this documentation is correct. So, nursing owns blood loss in C-sections. If you give your total to anesthesia and you don't chart a QBL, then anesthesia's documented EBL will stand and will go in the blood loss totals. But once you document a QBL for a C-section, it negates anesthesia's documented EBL and will not go towards the blood loss total. And we need it to be counted, so we're going to either add it into our quantified blood loss or add it into EBL. QBL documentation by the RN changes anesthesia's documentation to read only. It does not count in the total. It puts a little note here that says deleted EBL values since QBL is filed. We see total blood losses on the delivery summary report, and you can see here's our 2-hour postpartum, our delivery total. OB surgical blood loss is 35 mils, but it is read only and does not calculate into the total. We also have totals on our I&O flow sheet. Once again, notice anesthesia's is read only and not calculated into the total. So make sure you choose the correct QBL calculator. So for a vaginal delivery, you're going to pick vaginal delivery, and it's going to open up like this. Make sure it says OB delivery calculator so you know you have the right one. I know it's often difficult to do quantified blood loss in a vaginal delivery, and we still see a lot of estimated blood loss depending on the physician. And so you would once again calculate that, put it right here under estimated blood loss in under lacerations in the delivery summary. Postpartum Qbo Calculator still lives in the flow sheet. If you don't have it there, you can wrench it in. And it opens up like this, and make sure it says postpartum QBL to make sure you have the correct flow sheet, the correct QBL calculator, I'm sorry. I've heard several of you say, I don't want to have to use the calculator. I don't want to have to put in each individual item. That's fine. You don't have to. We can work around that. What you can do is put in one of the substituted lines, put number 1, put your total of your dry weight, put your total of everything right here. And when you click accept, you're going to have your quantitative blood loss, which is what we want, because then it will populate the quantified blood loss line in our I&O and show that we did QBL. Big takeaways. QBL is evidence-based. We should do QBL whenever possible. For surgical cases, if anesthesia documents EBL and the nurse does not document QBL, it will count in the total blood loss. But when the nurse documents QBL, it will change anesthesia to read only, and it will not count in the total blood loss. Nursing documentation of QBL in C-section is the source of truth. We are the owners. We need to make sure blood loss is correct. We need to make sure we use the right calculator for the given situation, whether that be a C-section, a vaginal delivery, or recovery. I've had several questions about the OB hemorrhage risk assessment. It is done on 3 distinct times upon admission. That means when a patient comes to the unit. So that includes antepartum and triage. And this is the postpartum hemorrhage admission assessment. Then we have the pre-birth assessment, which is all the time mom is in labor. So this is going to start when you document rupture of membranes or the start of active labor. And then this pre-birth assessment needs to be done every 12 hours until delivery. After mom's delivery, we have the postpartum post-birth assessment. This is done 1 time. So if you look at the sections, so for admission, when they come to the unit or they're triaged, you're going to do this section right here. All of these questions right here are going to be done every time we do our risk assessment. When they're in labor, you're going to do all these plus these every 12 hours until she delivers. Once mom delivers, you're going to do the postpartum risk assessment or post-birth risk assessment. You're going to do all of these, and hit yes on here. And that is going to show that it is completed, and then you're done. You shouldn't have any more postpartum. Where is the best place to access for documentation? And that would be under required documentation. So for the admission assessment, it'll populate under required for admission. And then for our pre-birth, it's going to populate Q shift under our required documentation. And then once again for our postpartum hemorrhage post-birth assessment. And then after post-birth, it should not fire anymore. If you guys have any questions, concerns, please call, text me, or email me. I am happy to help. Thank you for your time.